Good evening. At Close Care, we welcome you to the first of a series of informational video sessions pertaining to patients with diabetes mellitus. Tonight's topic focuses on the COVID-19 pandemic and its effect on patients with diabetes mellitus. If you or a loved one have diabetes, I'm sure you're concerned about your risk of developing the infection or its risk of complications when you do have diabetes. Tonight, Dr. Wasim Haque at North Texas Diabetes and Endocrinology will explore this topic in more detail.
Hello everyone. As we deal with the COVID-19 or coronavirus pandemic, we often hear in the news that people with underlying medical conditions are more prone to get severe coronavirus disease. And among those conditions, diabetes is often listed in the top three. That creates anxiety among many of our patients. So I'll try and answer some of the questions they have had about this connection. As you know, the COVID-19 or coronavirus affects people with underlying risk factors. These include old age, above the age of 65, particularly in those who reside in nursing homes or long-term healthcare facilities. And because it's a respiratory pathogen, those who have severe asthma or lung disease are also at higher risk. But diabetes is listed high up there in underlying conditions that CDC has identified in those who develop severe coronavirus disease. Other conditions that are associated with that include immunosuppression from steroid treatment or transplant patients or patients who are on chemotherapy for cancer. Patients who are severely obese, particularly those who have obstructive sleep apnea. Patients with certain heart conditions, kidney disease, and those that have high blood pressure. So what's the connection between diabetes and coronavirus? If you have diabetes type 1 or type 2, it does not by itself increase the risk of you contracting the disease or having severe infection. As long as the diabetes is well controlled, you're healthy and you do not have complications of diabetes. But having diabetes and other risk factors can make the risk significantly higher. So if diabetes control is poor, meaning your hemoglobin A1C is above 7.5 or 8, or you are older, above the age of 65, or if you have lung disease, or you're severely obese, and diabetes with heart failure or severe heart disease, and diabetes with kidney disease or dialysis, puts you at risk. Diabetes by itself, if it's poorly controlled, like I mentioned before, with high A1C, or if the glucose levels are above 180 milligrams per deciliter during the day, that puts you at high risk. Now, why does diabetes increase the risk? It's because when your blood sugars are high, it affects your immune system. The immune system becomes slow and weak, and you are prone to infections, including coronavirus. So how do you reduce the risk of coronavirus if you're a diabetic patient? Well, the first thing is to use precautions that are applicable to anybody. This is a respiratory pathogen. It's carried in droplets from your mouth, from your nose. So isolation or keeping away from those who may be sick is a good idea. And these days, because it is so widespread, social isolation is recommended as best as possible. Stay home when you can, work from home if you can, wash your hands frequently, clean the surfaces around you, because this virus can stay alive on the surfaces for at least a few hours. And again, avoid social contact as much as possible. Avoid touching your face or nose or eyes, because respiratory droplets can carry this virus. And try and wear gloves and masks as much as is possible. But people who have diabetes, they have to take other measures in addition to prevent complications or complicated infections. They have to check their glucose frequently so that they can identify if their diabetes control is good. And then try and maintain the glucose numbers in good range. By that I mean fasting glucose less than 130 milligrams per deciliter and random blood glucose less than 180 milligrams per deciliter. And have balanced nutrition so that you get healthy carbs, your proteins, your fruits and vegetable servings. One of the important things that a diabetic patient can do these days is to make sure their clinical care is updated, which means that if they have not seen their doctor recently, they should at least see them through a telemedicine visit. This will allow their doctor to make sure their diabetes control is addressed and any prescriptions that are not current are updated. You do not want to be without your prescription in these times. Also, you take steps so that you have stock of supplies available in case there is a shortage of certain key things that you may need in case you have infection. So make sure you have your test strips or ketone strips available if you're a type 1 diabetic patient. Make sure you have glucose tablets or glucagon available if you are brittle diabetic and prone to hypoglycemia. And then there are certain over-the-counter medications that should be available to you in case you were to get sick and are homebound. For example, Tylenol or acetaminophen for temperature, over-the-counter cough and cold medicines, rubbing alcohol, and nausea medicines or medicine for diarrhea. You should have some supply of that, perhaps after talking to your physician about that. Always have some bottled water available for you so that if you need more fluids and there is shortage, you are not left dry. In case you get nauseous or if you have high blood sugars, sometimes you may need things like jello or broth or sugary liquids or non-sugary liquids to stay hydrated in case you are nauseous or sick. And always have some supply of what we call easy on stomach food like crackers, vegetable or noodle soups, or yogurt available to you. What are the symptoms of coronavirus? So 80% of patients who get this virus have mild disease. 15% would have severe disease, and 5% would be critical. So the mild disease basically resemble common flu. It's just slightly slower in onset, but your typical symptoms are high fever, dry cough, body aches, maybe headache, occasional runny nose, and slightly sore throat. But if you start to feel short of breath, if you start to struggle to breathe and get weaker, that may indicate that your condition is getting worse. And that happens in a small minority of cases. There are symptoms that are common to the COVID-19 infection, common cold, flu, and allergies. And this is a slide from CDC trying to help people differentiate between these conditions, which sometimes is difficult. But as you can see, for COVID-19, symptoms of fever, dry cough, shortness of breath are much more common than others. So if you develop coronavirus illness, what should you do? Well, first of all, don't panic. If you are diagnosed with it, most people remember they have mild disease. Call your doctor and maybe get a telemedicine evaluation. In mild cases, you're going to be prescribed Tylenol or acetaminophen that you can take two to four times a day as required. You will be asked to drink a lot of fluids and some symptomatic treatment depending on what is the main symptom that you have. As far as the diabetes medicines is concerned, it's important not to hold the diabetes medicine when you're sick without advice from the doctor. Which brings me to a very important concept called the sick day rules for diabetes patients. When you are first diagnosed with diabetes, particularly type 1 or insulin requiring diabetes, part of our training to our patients involved teaching them what to do when they're sick, what to do with their insulin, what to do with their food, and what symptoms to watch for. If you have not received that training before, I would encourage you to contact your physician, and maybe one of the local dietitians or diabetes educators would have these programs available through telemedicine, so you can learn these specific skills. Essentially, when you're sick, if you can remember the mnemonic sugar, insulin, carbs, and ketones for type 1 diabetic patients. Number one, when you're sick, you need to check your blood sugars more frequently. For type 1 diabetic patients, it may mean checking their blood sugars every 2 to 4 hours sometimes. For type 2 patients, it depends on what medicines they take, if it's mild or moderate or severe case. Number two, always continue taking your insulin when you're sick, even when you don't eat. Because during sickness, your blood sugars actually go up because the body produces stress hormones to help you fight the infection, but those stress hormones cause your blood sugars to go up and you actually require more insulin. Particularly the basal insulin or the long-acting insulin that you're taking, you would need that and more when you're ill. So you should never stop that without checking with your doctor. And then even if you're not eating, you may have to take smaller dose of the short-acting insulin based on glucose readings. So when you're sick, you tend to get nauseous when you're diabetic. So you have to make sure that you have enough carbs and fluids. In the absence of food, you may have to drink fluids that have sugar in them. You generally need about 100 ml fluid every hour or two to stay hydrated when you're sick. And then if you're type 1 diabetic patient and you are feeling sick, if your glucose levels are above 250 or 300 milligrams per deciliter, you may have to check ketones to make sure you can ward off diabetic ketoacidosis. Type 1 diabetic patients, when they're not eating or when they're sick, if they don't get enough insulin, they start to burn fat, which leads to ketoacidosis and dehydration. That is a serious condition and you must take measures to stop. So once again, the sick day rules, because they're so important for our patients with diabetes. Do not stop insulin, particularly basal insulin, when you're sick, even when you're not eating. Do not generally stop diabetic medications without checking with your physician. Your physician may ask you to hold metformin if you get very dehydrated when you're sick. And they will probably ask you to hold these medications called SGLT2 inhibitors, which are great new medicines, but with limitation that if you're not eating or if you're dehydrated, you have to hold them for a couple of days. These medicines include Farxiga, Jardiance, and Invokana, among others. if despite these measures you start to get weaker, and if your ketones in the urine build up, and then you must call your doctor. Some of the signs of diabetic ketoacidosis are extreme thirst, frequent urination, nausea, non-specific abdominal discomfort, and weakness and confusion, rapid breathing. If those symptoms are appearing, even if you can't check your ketones, you should contact your provider. And if it's in the context of the coronavirus flu, if you're getting more short of breath, that's the time to call the doctor. So I hope this information was useful, and this current situation will motivate you to improve your diabetes care and to have a game plan if you were to have an outbreak of coronavirus in your community, or if you were infected with it, so that so that there is some positive out of the situation. I think if you are proactive and take steps, we'll be okay at the end. Good night and good luck.